It's about the restoration of our republic. We want to educate, encourage, enable the power. We stand for integrity, honesty, self-reliance, self-defense, and most importantly, no compromise on our foundational principles. This is America's Voice Now.
Find America's Voice Now on Facebook and at AmericasVoiceNow.org. Here's Michael Evans.
Good morning, America. You're listening to America's Voice Now. My name is Michael Evans. I am your host this morning. Appreciate you joining with us. Thank you. We're going to tackle a few subjects this morning that are on my mind and are current in the news. You know, our goal is to educate, to inform, to drive motivation for you to become a grassroots activist. And that activation takes a number of forms. One is communicating with the traditional model of getting a hold of your legislator and trying to influence the decision-making that goes on in Washington. We all know that that's very difficult to do because, for all intents and purposes, Washington seems to be completely operating completely independent of the electorate. But on the other hand, we also can take action and grassroots activism on our own behalf. In other words, we don't have to wait for government to tackle all of the issues or respond to us when we go to them with a problem. A lot of the problems that are inherent in our society today and inherent in our towns and our counties and our cities, we can resolve locally. And I want you to be cognizant of the fact that there's an old phrase out there, all politics is local. And that is the truth. And so what we should be doing is looking for ways in which we can make a difference locally as well as on a state and a national scale. What I mean by that is you should be considering a run for local office. When I say that, I mean perhaps in your city council, perhaps on your town council. Perhaps you should be running for the school board. I mean, if you're against Common Core, do something about it. If you are looking for the ability to influence change, then take an active role and do something about it now. Don't wait for someone else to do it for you. There is no one else. You are the one. It's that simple. Make a change in your local community. Run for a school board, run for the city council, run for the mayorship of your town, run for a county commissioner's office. Take over the slot and begin to make changes from the inside. You know, I don't think most people realize how important a county commission office is. They make policy that affects vast numbers of people and geography. And so I'm encouraging you to take a serious look at that. You know the folks in your community. You know whether or not you're well known in your town or your city or your county. It may take some time from you, but it is important that we begin to work locally. Run for state representative. State representatives can make a difference, especially as things begin to unravel on the federal level. As things come apart on the federal side of things, you have the opportunity and the ability and the wherewithal to make changes, effective change, right here locally. All right, we're going to tackle 4 topics today. One is the ongoing epic fail of Obamacare. You know, and I'll save this for the segment, but what we're seeing, and I watched an interview last night with Kathleen Sebelius on Communist News Network. CNN. And, you know, the first half of the interview were such softball questions, I almost felt like grabbing a hold of the guy through the TV set and wringing his neck and saying, come on, get to the point. Ask her the tough questions. And he treated her with such deference, and he kept calling her Madam Secretary. And I'm thinking to myself, this guy is almost treating her as if she is a lady of the manor. The truth of the matter is, ladies and gentlemen, that Kathleen Sebelius is responsible for one of the most heinous crimes against the United States that's ever been perpetrated. The advent of Obamacare, or health care as a nationalized project, as a nationalized industry, is counter to everything that we've ever known or believed in. And it is not. Again, I reiterate, and I even heard Bill O'Reilly mention this last night, which is unusual. He's generally, a moderate in terms of being able to point a finger at a given individual and holding them accountable. But even he referenced the fact that we are now looking at a heavy push towards socialism, and it's all over the media now, especially on Fox. There have been a lot of them talking about the fact that this thing may have been designed to fail so that they could move it to the next level, which is universal payer. In other words, they'll come back out and they'll say this thing is such a disaster that the insurance companies have bungled it so bad that it's not going to work because we didn't get enough people to sign up because those dirty, mean insurance companies charge such high premiums. And so therefore, since it failed, we're going to take it to the next level. We're going to push right through this interim step, and we're going to march right into the arms of universal health care with a single payer option, that being the federal government. Whether that's true or not is anybody's guess. We can all speculate on what they thought or what they're thinking or whatever the issues may be, but we don't know for a fact. Our next topic is going to be a new court case that has ruled that GPS and the use of GPS as a tracking mechanism by law enforcement has been determined by the court to be unconstitutional unless they get a warrant. Now, that's a good thing for America. The downside to that entire ruling is that while it does make it incumbent on law enforcement to obtain a warrant, the one area that it left out, and of course this couldn't have been decided by this court at this level anyway, but the one area that it leaves as a glaring loophole is in the NSA's utilizing your mobile phone as a tracking device. And with all due respect to everyone on the moderate side of the fence, that's exactly what they're using this device for. This is a personal tracking device. Tracks you in your car, tracks you on foot, tracks you at work, tracks you at church, tracks you at school. That's exactly what it's for. All other benefits aside, the negatives in this case outweigh the positives in the sense that the real function of a mobile phone is that it, for the NSA's purposes, it acts as a de facto tracking device where all of your activity can be monitored. Our third segment is a brand new report by the IMF. Now, the IMF is the International Monetary Fund. They are a favorite group of mine in the sense that they are, for all intents and purposes, a scheming, conniving cabal of bankers that are seeking to siphon the wealth from America. Not just America, by the way, but the nation. They are advocating, amazingly enough, a global, wait till you hear this, this is going to blow your mind, a global one-time tax on private wealth globally. I'm not kidding you. If you have positive wealth, in other words, you have more assets than debt, their idea is a one-off, one-time tax of up to 10% to reduce government debt. Ladies and gentlemen, you've got to be kidding me. That's a confiscatory, communistic concept that is so Orwellian, if it wasn't in writing, I would believe that maybe it was the plot of a science fiction novel. We're going to talk about it. It is their plan to plunder the wealth of the world. And our last and final segment will be the Farm Bill, food stamps, and fraud. The push is on right now, between now and the end of the year, for two things to be passed by the dictator-in-chief. One is the Farm Bill. And I don't think most people quite realize how dastardly the Farm Bill really is. It is 80% food stamp money. 80%. And for the record, I got to tell you, the Farm Bill is a $955 billion program. You heard that number right. Let's round up for argument's sake, just because it's simple to use the math. And recognize that at $955 billion, it is a $1 trillion expenditure. $1 trillion, of which 80% will be food stamp money, is an $800 billion disbursement to the USDA to continue to enslave Americans into the dependency of EBT. Meanwhile, 1 in 7 Americans are now on EBT and food stamps, with a cost that went from $35 to $75 billion in only 4 years. The last thing we need is to encourage, 1, the USDA to squander more taxpayer money. 2, with the last thing we need is to encourage Obama and the Congress to increase or develop another permanent entitlement program where, number 1, it is a program of dependency that has the effect of a drug on those people who are utilizing it. In other words, the concept here is that this is so dangerous to our sense of independence, our sense of self-worth, self-esteem, self-reliance, and self-responsibility and self-governance, that it is the equivalent of handing a known drug addict a syringe full of heroin. That's exactly what this is, ladies and gentlemen. This is nothing other than government-sponsored drug addiction. The drug is this little plastic card that says EBT. I get it that there are people who truly need it. But to have gone from $34 billion a year to $75 billion a year in only 4 years, with an increase of a staggering, it's more than double what it originally was. In only 4 years, you can't tell me the economy is that bad. What they've done is raised the qualifications on income. They've raised the income qualification so that more people can fall up underneath that new threshold. And of course, there are certainly people out there who will, willingly jump on the bandwagon and apply for food stamps, and they're getting staggering amounts. Meanwhile, by the way, there are repeated cases of them selling these food stamps and turning them into cash on Craigslist and on eBay and other places. Believe it or not, it's actually being done on places as public as Craigslist and eBay. Now, it's a crime to do that, but try to police it. You can't. And those that aren't doing it online are actually just doing it locally. The fraud, the abuse, and worse yet, the USDA is skimming off the top. They are collecting this money from taxpayers, skimming off the top their share, and then dispersing the rest out to those newly addicted, newly minted addicts nationally. All right. I want to get on it because it's quarter after the hour, and I want to get onto this thing with Obamacare. The White House is meeting with insurance chiefs. That's the headline from Politico. What that tells you is, if you turn that headline around, the bosses have called Obama in for a meeting. Because here's the problem. If the insurance industry, who was promised by Obama that they would benefit from this plan, and that's why they got behind it in the first place, don't forget that part of their fear is that in the event that this thing ever goes to universal health care and a single-payer system, the insurance companies are out, much like the banks were out and are now out permanently in student funding for higher education. Remember, the White House took over that whole segment of the economy. They've nationalized higher education funding by making you apply through the federal government for any college funding. You cannot go to a bank anymore and say, I want a student loan. It can only be done through the government. And so to assuage the fears of insurance companies, which, let's be honest, they have a lot of lobbying and financial power, the president promised them that they would benefit from this. And they have. They're raising their rates, and they've been raising the rates for the last 2 years in anticipation of October 1 coming. Yesterday, it was announced that over 300,000 private insurance plans in Florida were canceled. Listen, we knew this was going to happen. I've been warning about this since the day Obamacare was approved by a dirty trick by Harry Reid in the Senate to pass it on a simple majority vote, which was a parlor trick. This is not about health care. This is all about control. It is all about gaining information and data to use as a weapon against the citizenry and the electorate, the constituency of the average Joe six-pack. That's what this is. It is nothing more. And it is secondarily a means and a method to siphon wealth away from those Americans who have some for redistribution to those other areas in the nation where they can buy votes, essentially, while meanwhile pulling off a substantial cut for themselves. Ladies and gentlemen, I got to tell you, this is so far gone that we are so far down the road of corruption, of entitlement, of elitism, of a caste system where we have a ruling political elite, a ruling corporatocracy, and everybody else. So I've got to tell you, when the White House calls a meeting with the insurance chiefs, the reality is that the insurance chiefs called the White House and said, excuse me, we're coming for a meeting. Because they know that if people can't get through this website to sign up, they will be left holding the bag. And here's why. Those people that do sign up, and the earliest ones that are trying to sign up, are those who have been blocked by the insurance companies for all these years from actually getting a plan. In other words, these are the same people that the insurance companies have rejected all along because they had pre-existing conditions, or they had long-term degenerative problems like diabetes and things like that, where they knew that the long-term prognosis for them was that they would have a long life, but it would be very expensive to care for them. And so the insurance companies know that if they don't drag the youth in here, who ordinarily don't buy insurance, don't want it, but do have the wherewithal to pay for it, if they didn't drag them in, that this entire thing will collapse. According to Sebelius, by their own statement, they need 7 million people to join in the first year. If they don't have 7 million people, and by the way, a significant portion of that has to be young people that are ordinarily would not buy insurance, because their premiums will go high in order to cover the premiums that they're not going to be able to get from the poor and the downtrodden and the helpless and the hapless and the whatevers. If that doesn't happen, and the young are not subsidizing the poor and the indigent and those who have not had insurance before, the entire house of cards collapses. And the insurance companies will be the ones left standing there holding the bag, because they have already committed and enrolled and signed up those people who have the highest cost to their health care, and they have nobody coming in to subsidize it. And they're going to get left with this massive bill that they've got to cover for the health care of all these indigents, and no high-quality, non-ill people subsidizing it. They're counting on the 20-somethings coming into the system and paying these exorbitant premiums and never actually using the health care. You understand? I mean, it's real simple. You need those who need health care, and then you need those who need no health care. And everybody pays the same rate. So these people who need no health care, there's no actual bill that they have to pay at the end of every month for them. Meanwhile, the guy who's got, chronic heart disease, or the guy who's got chronic, emphysema, or the guy who's got chronic diabetes, or the guy who needs a liver transplant and he's on dialysis, or kidney transplant, whatever the heck it is. The point is, look, what we do know is this. Sebelius was questioned directly by Sanjay Gupta, who was the interviewer last night on Communist News Network. And towards the end, he began to get a little bit more aggressive in this interview. But she refused to acknowledge how many people have actually not signed up for an account, because that's not the true indicator of how many people are enrolled, but actually enrolled. In other words, you sign up, you get your figures, you choose a plan, and then you are enrolled by insurance company X, Y, or Z. Okay? They will not divulge those records. There has been a group out there who has done some work on trying to identify what it is, and they say it's about 175,000 people who have actually been able to get through the morass of the website to sign up. But there have been a lot of misnomers, and I listened to a discussion last night after the Sebelius interview, in which they had this supporter of Obamacare saying, but there's so many different ways you can sign up. You can call in. No, you can't. You call in, and here's what they tell you. You have to create an account on the website first, and only then can they enroll you over the phone. So if you can't get into the website to create the account, then they can't help you. So that's a lie. The second issue they say is, well, there's all these navigators who can help you walk through it. Well, that's true, but only if the website works, because the navigators themselves cannot sign you up one-on-one individually. They must enroll you through the website, but it's for people who don't know the difference between a mouse and a keyboard. So, but when you go and sit down with the navigator says, okay, so here we're going to go. We're going to log on. What's your name, ma'am? Mrs. Jones. What's your name, sir? Mr. Jones. What's your date of birth, Mr. and Mrs. Jones? And they type it in for them. But they're not enrolling them any differently than they can enroll themselves. The only difference is they can't figure out how to type their name in because they're computer illiterate. That's what the navigators are for. The problem is that if the website doesn't work, neither the navigator nor the computer tech expert can get in to sign up. And the truth of the matter is that at some point in time, and there's clearly, they're talking about 500,000 lines of code. Listen, folks, I work with code every day. That's what I do for a living. Clearly, it's not this. I work with code every day for a living. 500,000 lines of code is a staggeringly high volume of actual computer instructions that tell the computer what to do. You see, computers, and if you're not, really cognizant of it, computers only do exactly what they're told. If you and I are having a conversation and we are discussing an issue, and I make a mistake in what I'm saying, you have the rational intelligence and the ability to kind of observe and say, well, I understand what you mean. Computers can't say that. I have to tell the computer, go left, go right, go left, go right, go left, go left, left, right, 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 left, right, left, right, left. And if I make a mistake anywhere in those directions, the computer says, oh, that's it. I don't know what to do. I got to stop right here. And it freezes. When you've got 500,000 lines of code, recognize the total number of mistakes that can be made. And it only takes one mistake. It can be leaving off something as simple as a semicolon or a quotation mark, or as simple as leaving off a period. It can be a misspelled word, and the entire train comes to a screeching halt. The other problem that they've got is that the code that they're using is about 10 years old. In other words, they're writing in, for all intents and purposes, Aramaic in the computer industry. It's a shambles. It's a shame. We've spent somewhere close to $600 million for this, and it is absolutely as useless to us. I'm not even going to use the analogy. I'll get in trouble. It's radio. You see, what we now have is HHS has completely bungled this. The insurance companies are getting angry. The president is embarrassed. He made such a fuss about not extending to 1 year the private mandate for the tax penalty, that at this point he'd have an enormous amount of egg on his face to go back and say, you know what, it's such a debacle, we are going to back it off and we're going to hold off for the year. Because that would give credibility, that would give credence to the argument that the Republicans made during the shutdown. And that, ladies and gentlemen, for a president who acts as a juvenile and has a hissy fit as soon as someone disagrees with his either ideas or policies, is an unacceptable position for him. What we now have is a nation that is basically spending billions and hundreds of billions of dollars so that we don't upset the little boy. I mean, he's like the boy king. I want it, and I want it now. It's a shame. It's a shame that the United States has descended into such unconscionable failure, openly, willingly, and acceptingly. It's a shame that our nation is for sale to the highest bidder. It's a shame. They say, well, we're bringing in the best and the brightest to resolve this problem. With all due respect, where were the best and the brightest over the last 3.5 years when you had to build this? Sebelius actually had the unmitigated gall to say, well, if we'd have had 5 years to build this, we would have done it. But people couldn't wait 5 years. With all due respect, Ms. Sebelius, websites of this nature and this magnitude and this complexity are built every day by private industry, and they take 5 months, not 5 years. You're an embarrassment to the nation. You're an embarrassment to the administration. And quite frankly, your level of incompetence has reached the level of criminality. You've been listening to America's Voice Now. We're going to take a quick break. When we come back, we're going to tackle our second issue, the GPS issue. The Third Circuit has ruled that GPS must have a warrant by law enforcement in order to be used. They can't walk up and slap a GPS device up underneath the wheel well of your truck and monitor where you're going without a warrant associated with it. We're going to talk about why that's important, but more importantly, we're going to talk about the exception that resides in that. The exception is that this only applies to law enforcement, but it does not apply to our favorite friends over the all-knowing, all-seeing eye of the National Security Agency. Find us on the web at AmericasVoiceNow.org, Facebook.com/AmericasVoiceNow, and YouTube.com/AmericasVoiceNow. We'll be right back.